Hello, everyone, and thank you
Hi,
for
Olivia.
having me. I'm very excited to be a part of this symposium. My name is Olivia Pollard, and I'm a recent graduate as of November 10th of Walden University in the School of Management and Technology. My study is titled The Delphi Study Analysis of Best Practices for Data Quality and Management in Healthcare Information Systems, a mouthful. Um, I'm going to start with the purpose. I chose this particular area of study because I have had personal experience working with data and databases. Data can be an unstable and unforgiving beast that at many times, especially today, can grow out of control. In healthcare alone, there are many strides being made to utilize data to help to take advantage of opportunities not previously seen in improving patient care. The purpose of my qualitative Delphi study was to identify best practices for data quality and data management in healthcare systems to assist in making a better impact on community resources through decision making. My research question was, there was one overarching research question used for the study, and the question was, what practices contribute to identifying improvements in EHR, electronic health record, data collection, secondary use of data, data quality, and integrity? Primary data was gathered directly from the participants' knowledge and experience. The multi-perspective population consisted of 24. The goal was 25, but one participant didn't respond in time, so I had to leave them off. They were different. They worked with different healthcare systems, and they were data management professionals, also known as data stewards, across the United States who have worked or are working for a healthcare system, such as an EHR, working with the healthcare system or applications such as an EHR, and have managed the data within this system over a period of 5 years or more. Participants were recruited from sources such as LinkedIn, trade associations, and networking. The panelists were chosen using a purposive sampling technique. The criteria included professional level experience with healthcare data and IT or non-IT positions with data quality. I preferred that the panelists were currently working with the data. Next slide. The results, and I'm sorry I didn't include any pictures. I was in a rush to get my slides together. So as a result of the study, using the previously stated research question, I carefully broke down the question into key components and found the following. Through the 3 rounds that I gave the participants questionnaires to answer, in round 1, the participants were asked to answer 4 open-ended questions. A list of words that emerge as themes throughout the responses were derived by using the SurveyMonkey word cloud feature, which allowed for a search through all the responses to create the word cloud based on the words found most often in each response for each question. In round 2, to extract best practices that were most representative of the data statements within the highest ranking, I looked at those that ranked strongly agree at 50% or higher, and used those. There were no statements in which the participants unanimously strongly disagreed, and there were 29 statements used to transform into 33 best practices. Some statements formed 2 best practices. Any statement that resulted in a duplicate best practice was not included. In round 3, the participants were asked to rank the 5 best practices provided in each question on a scale of 1 to 5, with 5 being the highest. The themes found to rank closest to 5 were usage training, timeliness, clear processes, eliminate redundancy, corrections, and audit. There was a tie between quality alignment and strong decision-making in question 4, in which the lowest standard deviation was used to break the tie. The themes found to rank closest to 1 were data quality, definitions, automated processes, trustworthy data, integrity, roles, responsibilities, ownership, validation, and metadata. A view of the best practices side by side to compare how they rank visually was necessary to understand how much of a difference the best practices were from one to the other. For example, although most participants discussed data quality definitions quite a bit in the beginning, In the end, usage training was found to be more important to best practices. The two rankings that were the most surprising was the elimination of redundancy over integrity of the data and audits over validation. The conceptual framework of Blum and the data quality assessment framework, which is the DQAF, were used to guide the structure of the Delphi study questions and to identify what information to collect. The DQAF was used to provide assessment measures based upon data quality dimensions and information theory, which is the Blum model. This assisted in categorizing the type of information into each data quality dimension to be assessed. The key findings identified what the known best practices in the data quality industry were, what best practices help to improve data collection in healthcare systems, what the most important best practices in data quality and integrity were, and what best practices address the secondary use of data. Okay, next slide.
So Olivia, before you move on, Alex asked, could you repeat the 5 best practices?
The 5 best practices that ranked close to 5 or 5?
Yeah, I think that's what they're asking.
Okay, those were usage training, timeliness, clear processes, eliminate redundancy, corrections, and audit.
Great, thanks.
You're welcome. Okay, so the recommendations for future research, the consensus among the IT and non-IT healthcare systems data quality participants identified principal best practices that directed towards timeliness, eliminating redundancy, that's repeating them again, ongoing rather than retrospective corrections, enhanced audits, combining both human interface audits along with business plan software, possibly artificial intelligence, earlier decision making, user training, and the need for clear, transparent data management processes. Inclusion of these best practice guidelines will enhance existing accountability measures to reduce the number of digital errors in EHRs and other healthcare systems, resulting in an increased likelihood of optimal decisions and quality assurance. Outdated and obsolete best practices should be abandoned as ineffective and inefficient to address the rapid changes in technology in favor of current best practices or not included at all. While integrity, validation, trustworthy data, ownership, data quality definitions, automated processes, roles, responsibilities, and metadata are still important, how they are addressed and managed has changed dramatically, even within the past decade. Processes and best practices should be reviewed frequently for currency and monitored, particularly when a significant software update or new technology for data management is introduced. Data quality and integrity are key to appropriate patient management and treatment. Best practices that ensure the quality and integrity are not only essential to the success of an organization, but also to the overall healthcare delivery system and practices throughout the healthcare industry. As technology changes, the policies and practices that ensure data quality and integrity must keep pace. Where data integrity, accuracy, and quality are critical, such as a patient medical record, healthcare organizations must adopt effective and continuous monitoring practices that address data quality. Along with those practices, leaders should impanel an in-house panel of experts that includes all stakeholders, from individual user, IT application specialists, along with cross-functional representation of all affected by data flows. There should be an allowance for modification and a review for currency of the best practices in place, or any standardized best practice created as a result of this study. The implication of social change, this study has the potential to be significant as it may offer insights that could affect the way healthcare organizational leaders and managers view their data and make decisions within their communities based upon said data. Trends and patterns identified in the study could also provide a basis for understanding what data quality deficiencies may be present in the secondary data when making determinations about services. Such trends and patterns could eventually strengthen patient quality of care. The public could benefit from the study's findings, as there could be an increase in needed services in the community. The findings could ameliorate healthcare service and reductions or even eliminations that result from insufficient or incorrect data. In conclusion, I would like to present one very important quote from an individual within the industry I feel capture the essence of my study. The quote is, "Data is useful. High quality, well understood, and audible data is priceless," from Ted Friedman at the Gartner Group. And that's it.
Thank you, Dr. Pollard. I
You're
wasn't aware
welcome.
that you had completed, so that's great. Congratulations.
Surprise!